Hello, doctors, students of homeopathy. Today is the 1767th day of uninterrupted daily webinar of IFPH, and our guest for today's international webinar is Dr. V.K. Karunakar, Medical Officer, Government Homeo Dispensary, Nellore, Tamil Nadu. He was the former Assistant Professor, Government Homeo Medical College, Kadapa. He is the Senior Consultant at Karina Homeocare, Kadapa, Vinayaga Homeo Wave, Hyderabad, Yashodhara Homeo Clinic, Nallur, and he do have more than 14 years of clinical experience. Today's session is the second part of the topic, practical difficulties in implementation of guidelines in case taking and its impact on cure in homeopathy. Let us welcome Dr. Karunakar, and I welcome you all for the session. Let me make you the co-host. Doctor, you can unmute from your side and you can start.
Good evening to all. In last class, we have discussed something about practical difficulties in implementation of homeopathic case-taking guidelines on its impact. So, on curative process in homeopathy. So, just a review in last class what we have discussed. So, from as usual, regular aphorisms 83 to 104, and also I have discussed so many things. What are they? Especially individualization and different types of cases, especially two types of cases, direct and indirect cases. And another one is in homeopathy also two extremes of people who are existing. One is too much believing and there is no believing towards the system of medicine. So like that, we are discussing few words. The knowledge is based on not only on their knowledge, but the way of receiving that one. So today I would like to discuss further continuation of that one. What are the practical difficulties we are facing in day-to-day examination of the case, why we are failure, and what is impact on curative process in homeopathy. So what is meant by cure? So one of the disciple of Kent has provided after examination of the one patient, nearly 30 pages of literature has provided to the Dr. Kent. So go through all these pages, Kent has rejected that one. So there was no case in this material. So today in the present scenario also it was happening. So what happening? We are write down more number of pages. So we are analyzing after completion of that writing process. So only one or two characteristics are available. Only one or two characters. There was no characteristic symptoms in our case. So why? So what is the defect? Where we have committed mistake? What is the problem? Where is the problem? We have to analyze today. So just a review. This one 83 to 104 aphorisms. Everyone knows there is no need to discuss all the things, but just I have to review. The 83 we are already discussed. So individualization process in which the physician must possess that characteristic features, unprejudiced nature, keen observation, and fidelity from the tracing of pictures, attention towards the patient. So I already discussed the attention is lacking towards. Why? Because more number of patients and there was no time to spend with patient, or sometimes patient is not cooperate with us, or sometimes we are unable to concentrate on characteristic features which are expressed by the patient. Whatever the things we are getting, the common, most of the timings common picture we are get from the patient. So it is very difficult to select a simillimum like that. So, but today I would like to discuss next aphorism. We have to, everyone knows, we have to started every symptom is a fresh line to give a gap, all other things. So for what are the purposes to give a gap or start with a fresh line, all other things? Why? Because initially the speaking of the or explaining of the patient is unable to give most characteristic features. Middle of that, one more caution, Hahnemann was given by one more caution while examination of the case or patient. So without his conscious. So patient is not conscious, you are examining the patient like that. When he is conscious, he is unable to give a right or correct picture. Unconsciously, he was delivered a few words which are more characteristic. When you are not paying attention towards that one, we are unable to observe those characteristics while writing the case. So unconsciously patient, you are always put the patient unconscious. So that's why Hahnemann was given to chit chat with some other things where you are coming. But today the process was deviating for up to some extent. Don't deviate. You have to, when try to put your patient in calm state, then started what is your suffering, what are the things are. But nowadays patients are started with, almost all patients, diagnostic labels. One of the allopathic physician exam in this one started like that, almost all like that started. So the original content which is essential for us, they are not given by it directly. So that's why you have to disturb the patient and to put in the right direction to get the proper information from the patient. This is another important what we are not following in our day-to-day case-taking process. And also another one is the sources of symptoms. So subjective symptoms and objective symptoms also we have to discuss. But in objective symptoms, the most we are missing essential part. What is that one? Examination finding and the investigative laboratory reports are given. It is also considered as one of the important objective symptom. Most of the symptoms, the laboratory investigations we have to see, just we have to reference. But if you read Boric Metromedica, so each and every particular organ under that particular organ, so each and every observe, maybe you take urine or blood samples, leukocytosis is there. It was mentioned in the Barita mode. Barita group drugs, leukocytosis, natrum group, leukemia, like the certain pathological terminology which was used in laboratory, these words are mentioned under our Metromedica. When you are whoever thorough with Boric or clinical Metromedicas, so you have to use these laboratory altered parameters as a characteristics. So I succeeded many times when I used these laboratory parameters as a characteristics. Most of the times, most of the homeopathic physician missing this characteristic, especially laboratory report investigation. So in that, especially the report says the maybe intensity of the symptom. Intensity of the symptom also, maybe mild anemia is there, moderate anemia is there. So how much amount of hemoglobin percentage. If you read certain drugs, they are mentioning it is a remedy for mild anemia, it is a remedy for severe anemia, it is remedy for. So if you are not understanding this word or terminology, if you are not matching, why? Because our homeopathic cures are depends upon the similarity. Our curative process is depends upon the similar. How much similar is there? So definitely cure takes place. So that's why, so even minor, always homeopathic physician must concentrate on minute details. Minute details are essential for selection of a similar. Why? Because it may be a differentiate the remedy. So Merxal is there for anemia, Palestella is there, cyclamen is there. So many remedies. China is there, Paramet is there. So in which circumstances this is a remedy for that circumstances. You are able to discriminate, you are able to identify through which you are getting similar remedy, and it is a very effective and more effective in curing the diseases. So that's why don't miss the laboratory reports analysis. Maybe it tells sometimes if you take the chest X-ray, what happening? Right middle, right. So left lower lobe, like that. If you read Metromedica, this is a remedy for left lung, upper lobe, left lung, middle lobe, so right lung, middle lobe, like that. So if you take it is a characteristic symptom, very easy to discriminate the remedies, and we are able to select a single. This is another important point what I have observed in day-to-day practice we are missing. So, and also whatever, it may be blood examination, urine examination, chest, or even if you have taken MRI brain or CT brain, whatever the thing, maybe infarction, thrombosis, or some other ischemic changes. So the words are described, Barita group, ischemic, or certain other group of remedies, overflowing, hyperemia, so congestion. How we can take? Through X-ray, through laboratory reports only, we are knowing. So internal organs, either part is under congestive stage or hyperemic stage. So certain remedies are for hyperemia, certain remedies for congestion. You are not able to discriminate or differentiate this one. You are unable to get the curative process. So that's why many times we are reached up to the process, we are not attaining our goal. Why? Because this discrimination we fails to identify. We are using that one. So like that, the pathological words are maybe swelling is there, edema is there. So many terms we have to use it in the report. Cerebral edema due to age-related, due to inflammatory or some other. Inflammatory edema, certain remedies are there. Degenerative conditions, certain remedies are there. So that's why the laboratory reports are also very, very essential for us to constitute the totality of the symptoms. So not only that, understanding it is the laboratory reports are evidence of our drug actions. Most of the times it is a false proverb is there. Our homeopathic people don't know to prescribe investigations, all other things. Yeah, it is essential for homeopathic people. Nowadays it was going on. So why? Because we are not taking before after treatment. If you take the before and after treatment, then only we can assure to the patient, yes, our drug is working, your disease is curative process. So not only constitute the totality, it also best evidence for your homeopathic cures. So keep in your mind, always you have to suggest. Most of the diseases were cured, but we fails to provide evidence. So scientifically in research work, so that's why we are not recognized up to the mark like modern competitive people. So that's why every homeopathic physician keep in our mind before treatment, after treatment. So essential reports, especially don't prescribe unnecessarily the laboratory investigations to the patient. And also whoever certain people are there frequently prone to attend to the laboratory investigation. This is also ailments from exposure to radiation, ailments from certain remedies were mentioned in our homeopathic Metromedica. When you have thorough with, very easy to prescribe. So these are all simple glimpses. There is no need to fight with or spending more too much time to the patient. So when you get one characteristic, sometimes one characteristic is enough for prescribing a right remedy. It opens the key. It opens the pathway of to clear up all obstacles to pavement the curative pathway in homeopathy. So that's why it is more important one. So it is, and also don't believe the patient, whoever attended along with patient, they are giving some details. Sometimes, so don't believe the details which are getting from the friends or whoever attending that one. You must confirm them, either how far they are reliable information given to you. It is more important. Most of the time, my friend was very irritable. My wife is very aggressive. My wife was very irritable for small things. Without understanding the situation which was going inside the house or inside the circumstances, you don't come to the conclusion. Why? Because so how far the reliability or trueness of that particular symptom is very essential. So that's why you have to give what we can do, how to overcome this difficulty, whatever then. So Hahnemann was suggested one more important. So in 87 aphorism, you have to framing the question. Framing the question is very important. Most of the timing we are asking routine questions. What is your suffering? What is your problem? When it was aggravated, when it was ameliorated, like that. We are insisting the patient to get without speaking some more information like that. Hahnemann was, so the questionnaire is not important in all other medical profession, but in homeopathy, questionnaire is more important. Framing the question is more important. Your question get the information from the patient's mouth. Even indolent, I already discussed in last class. So indolent, even indolent patient open his mouth to speak something about that one. Your questionnaire is like that. So the framing of the question is more important as per case taking guidelines 87 aphorism to get some true picture of the disease. Not only get the information to confirm the expressed manifestations, what you have observed in the patient. So most of the timing, patient is very anxious, patient is very irritable. Most of the timings with mental symptoms we have recorded, these are the things. Have you, a normal human being has almost all the type of emotional disturbances. How we know it is abnormal or normal? So whoever attended along with the patient, they are also telling he is a very irritable, he is a very impatient. So he is not having any patient to life. Without, so in those circumstances, what Hahnemann was suggested, what I have observed in my experiences, you have to given a situation. Without giving a situation, if you are asking either you are a good boy or bad boy, everyone said, I am a good boy. Or some people are there in negative aspect, I am a bad boy like that. But whatever the answer we are getting from the patient, either good or bad, it is not a real one. So you have to give a situation to the patient. The reaction we have observed that particular circumstances or situation, it is the reality. So mostly, according to psychology, stated that one. So you are alone. What you have, how you are behave. That was the original behavior in front of the chambers of the doctor, in front of you, whoever attenders are attended. Always the human psychology, according to human psychology, mind is always pretended. So that's why Hahnemann clearly stated that one. So why you are framing the question means either it is maybe a feigned disease or true disease. He was used one more term, feigned disease. So most of the timing in the mental picture are certain aspects for the escaping of the work. So for escaping of their original nature, so they are act. They are act. So the circumstances, any patient, any human being may not be continue their act. So without when you are giving a situation, when you are giving situation, so automatically their emotions are striken up and come out into the surface. This was the real picture. So that's why Hahnemann was given most cautious precaution is to give a situation to the patient. Either he is irritable, he is anxiety or thing. So one more point is also you have to observe, by birth itself, they have habituated certain emotions. They are considered as a normal. After developing his illness or after, so that's why in the personal history also, we have to inquire about things. So in the development of that one, where you have to move or what type of reactions are given, the change of weather or environment or place, it causes anything change in the economy. The change which was produced by these type of alterations more important compared with habitually by birth itself he has developing in his body. This is more. So most of the timing in homeopathy, what I have observed in my students, so they are not at all getting the good rank in the NEET or whatever thing. They are joined forcibly in the homeopathic course. So they are always thinking that one. They are not realized whatever the homeopathic profession is also good medical profession. We started to study all other things. So they are, even though they are intelligent students, even though they are they have capability to read, but they are neglected because of one cause is stagnated in their mind. So missing. So it causes so many. And also same thing, they are imagining some picture about the medical college or the response from the public. So when they are not getting from that one. So the further stagnation of some inferiority or some lack of confidence toward the system of medicine. So like that, in the patients also, what I have observed. So many patients are telling one thing, homeopathy is a slow. Homeopathy doesn't act in acute cases like that. I asked many times to my patients, have you checked? Have you tested? No, sir. Who said? Some other people. So who is spreading you? So he is having experience? No. So without knowing the originality of the taste of homeopathy, so they are propagated. Even students also, even our people are also said there was no scope of. So it is also another important point, scope and limitations of homeopathy. Is it any limitation is there in homeopathy? As per my experience, what I studied in literature, Hahnemann never stated limitation. Limitation is for curative process, not the treatment. Keep it in mind. So limitations for even acute emergency cases were mentioned in our clinical experiences by our stalwarts or in our repertory in Metromedica. I already discussed in last class also. Limitation for curative process. Certain cases are not cured. So that's why he has stated limitations for that one. So there is a scope for where we have to scope and limited. Literally, very we are studied on that one. Everywhere there is a scope. Even there is no possibility of the cure, there is a palliation. So you have to palliate the case. You have to, in the palliation also, what is the principle? Again, the law of similia only. Always everybody thought palliation means allopathic mode or antipathic mode or like that. This is also another important point. So keep in your mind, there was no limitations for the treatment, whatever the case in homeopathy. So it is also a old proverb stagnated in the minds of homeopathy. So urology, cardiology. So either homeopathy has scope in the cardiology, how to take the cases, how to examine the murmurs. You have to examine. Murmurs are there. Pulse is there. If you read, you have opened that one repertory, pulse one particular chapter is there. How many varieties of pulses are described? When you are experienced with that one, so you are able to prescribe a remedy, you are able to select a simillimum, very nice. Even angina pectoris is there. So even heart failure, respiratory failure. Such a rubrics were mentioned in the literature of the homeopathic medical construction and repertory. Is it they treated those cases and mentioned in the repertory or other things, or vaguely mentioned? So after so many experimentations, then only they bring into the repertory or medica. So keep in our mind why we are going behind, not come forward to take up cardiology cases or neurological cases or some other infertility cases, especially in the eye. So even in the eye, one rubric is there, loss of vision. Anybody have to explain, well, there is a loss of vision, remedy is there for loss of vision. Everybody, even all ophthalmologists are laughing. Is there blindness? Is there rubric in our repertory? So why, in which circumstances they have mentioned either homeopathy has scope in that aspect or not? We are not thinking, we are not conducting experimentation along with those guidelines. We are blindly come to the conclusion, yes, there was no scope. Somebody said, we are also said to our upcoming generation like that. So don't do this one. I appeal our homeopathic family. You have to conduct. Yes, I was conducted someone. Even blindness is reduced, curable in certain circumstances. For example, glaucoma is there. So because of glaucoma, the blindness has developed. So when you relieve the glaucoma, automatically blindness coming back. Or night blindness is there. Day blindness is there. Belladonna, bryonia, certain drugs were mentioned. So day blindness, night. So very, very clear, final discrimination is there in your medica and repertory. So try to read and understand and come to that one. So homeopathy is for chronic diseases. Here another important. So that's why here, why I already taken up this one, precise information. Precise information means accurate information and which is characterize the patient, which is characterize the disease, which is essential for understanding the disease process and the selection of a remedy. And also another important point here, come to that one, voluntary details. In according to aphorism number 88, voluntary details. I already some voluntary details are explained either good or bad or other thing. So nowadays, most of the diseases were born. So because of mind, mind is the root cause for diseases. How we can estimate the mind? How we are understand? Is it the mind is a complex phenomena? So Hahnemann was used most of the timing morbid phenomena. We are understanding the phenomena of the disease. Our remedy also connects the two phenomena. So our homeopathic law connects the two phenomena. One is disease phenomena, another one is drug phenomena. So the phenomena is more important. Keep in mind. Phenomena means the occurring event. Understand how the disease was started, establish the changes, even adverse effects are there. So how we are gathering or how we are getting the details means through history taking. So another important concept where we have committing mistake or facing difficulty in day-to-day practice is history taking. In the history taking, almost all are obviously your past life, either history of hypertension is there, hyperthyroidism is there, or fevers are there. Little few questions are asking and leave it. So, but is it sufficient for? No. You have to interrogate. So under the heading of life space investigation, there is a difference between life space investigation and the past history. Here, almost all the headings are there. So past history is there, family history is there, personal history is there, and life space investigation is there. So why? In this history taking, you must pay more attention towards to know the detail. Doctor is the only person to know the secrets of each and every human being. No man has existing on the earth. Why? Because every secret regarding marriage, regarding their personal problem like puberty, pregnancy, all other things, even they are maintained secret in front of husband, in front of their family members, but only either any gonorrheal history is there, any participated, any some desires were there. So many beautiful stories were there in our Medica. Even aversion to her own husband, aversion to her own children, like that certain rubrics were there. Anybody straightforwardly coming in front of you, I have aversion to my wife, I have to aversion to my children. Anyone is stated like that, even though they have inside the same feeling, but they are unable to express. I love my wife, I love my family, I love my children. Nothing was there in my. So if you are asking any tension is there, many times they said nothing is there. Nothing. My husband is good. My family is good. My personal relation is good. My financially good and everything. But if you are asking, if you are interrogate, so laboratory investigations also showing normal value. What is the problem? Hartman clearly stated, in last class I stated that one, disease and disease per se, without knowing the disease per se. So, how we can know? Through history taking only. The history taking is more important one. If we are pinching the patient, if you are talking chit chat as a friendly, and automatically they are open. Not in first visit is it may not be possible in the next visit, next visit. So that's why olden days concept is family physician. Now my family physician knows each and everything. So Hahnemann was introduced to that concept. So you have to interrogate each and every family member. What is the relationship between with the family members? Because of sometimes they are forcibly following that one. The person has to wear a modern dress, but the family is not allowing. The restrictions causes the suppressed emotions. Suppressed emotions causes so many manifestations. This is the commonest cause to development of the so many diseases in the human being. So that's why they are unable to state it. A mother and girl is coming to our clinic and complaining, my girl is not in a position to listen off. Is it have you interrogate any have love failures are there, love and affair, or how much loving your family are like that? If you are asking such a questions, they are straightforwardly said, I don't have any relationship. Any boy is coming to our clinic along with their parents, have you asked? So either habit of smoking is there, habit of alcoholism is there. He stated a real answer to you. No, majority of times. So really, why? Because I'm taking this one. These are all different concepts which are related to the mind, their personal seeks or personal thing. Without knowing those things, we are unable to get the characteristic features or we unable to understanding the patient. So which is essential for diagnosis of the person. Diagnosis of the person is more important for selection of the homeopathic remedy. So similarly, another important one is there. So the only thing is to have interrogate, pinching, chit chat, automatically they are open up at one part. Till the open up of their mind, you have to chit chat. Whatever the information brought or given by the patient, don't believe. You have to confirm. Or you are framing a special questions, you are framing a precise questions. So to get a information from that one, either any secretive. So Hahnemann clearly stated that one. So special to know the voluntary details in the 88 aphorism or some other thing. So to frame your own questions to get the information. So this is your take. So that's why case taking is an artistic process. Case taking is an artistic. How much you are open up the patient, you are getting more details by seeing itself. So that's why first visit is very difficult. In the next visit, it is a very easy to prescribe a remedy. Why? Because we know about each and every event of that particular person. Very, it helps to you to understand the constitution also. Another important point is examination. After that, either physical examination or systemic examination like that is there clinically we have to study it. So most of the timings, so what is the commonest proverb in the public? Homeopathic people don't know how to examine the even to record the BPR like that. This is a very annoying to us to hear or to receive such a statements from the public. But really, why? Because what I have observed, most if you are attended to the allopathic clinic, they are keeping the thermometer, they are tie up the BP apparatus to record the pulse, all other things. So by doing all these things, patient come to the some type of oh yes, I am under the examination process. In homeopathy, when the same patient attended to the clinic, what happening? How is your appetite? How is your thirst? Like that we are started. So we are showing complete different process, even though we are read same process in our clinical Hutchinson clinical manual, but we are not applied practically. It is also another important point. So you are examining the heart, you know. So how many objective symptoms of this is objective sign. So alteration of the heart rate, alteration of the pulse rate, alteration of the temperature. When you, for example, most of the patients attended to our clinic with fever. So how many of you examine their forehead or if you read literature, the upper part of the head is upper part of the body is heat. lower part of the body is cold, and only palms are cold. Only around the abdomen is cold spot is there. So without examining the patient, without touching the patient, how we can know? Is it possible to, we are maintain such a good environment to examine in our OPD room? Check ourselves. So either examination table is there in our OPDs, even institutions also. So without exam, even pyrogenum is there. If you record the temperature, high temperature 104, high pulse rate in proportionate to the temperature or proportionate to the temp. Such rubrics were there in Metra Medica. Without recording of temperature, without recording the pulse rate, how we can understand? So we are commonly selected either belladonna, high temperature is there, belladonna or rustax like that. But based on that one drug is there, one caladium is there. We never thought it is a very good remedy for fever. So in the caladium, so one statement was there. I have, in my experience also, I have to see one of the homeopathic student, she was treated by allopathic drugs, all other things, but fails to relieve completely. So what is that one? When fever started, she goes to sleep. When fever relieves, when wake up and playing each and everything is a normal like a normal individual. Only one statement is there in Alensky notes. When read that one, I administered one dose of caladium to the patient. So within 24 hours of span period, so complete fever is completely reducing that. So the small statements were there in our Metra Medica. So they are related to the examination. So that's why when you are properly examine the patient, you are getting more characteristic features, more characteristic features. So that's why it is another important mistake what I have observed or difficulties in the examination, how we are using the examination findings as a totality. We are constituting the totality. So this is more important to keep in our mind. So the examination findings are act like a good characteristic in constituting the totality. Another important in the history, almost whether 13 varieties of modalities are explained. So in the Metra Medica also you have to read, all are double-edged knives. Our drugs are double-edged knives. It is a remedy for aggravated in cold weather. It is a remedy for ameliorated in cold weather. In which circumstances it aggravates the complaint, in which circumstances it ameliorates the complaint. This is the most important. Without understanding, a nearly clear fine weather is there, damp weather is there, damp wet weather is there. So when patient explaining about their modalities, so how we are confirming? So this is also another important practical difficulty. So most of the timing we are assuming, we are interpreting ourselves, this is a so-and-so modality and prescribing the remedy. After in the second visit, patient come with there is no result. We are analyzing why I prescribed a right remedy to the patient, but remedy fails to act. So that's why Hahnemann clearly stated that homeopathy never fails. Homeopathy fails. So why? Because these minor difficulties are while taking the case, we are missing. So these are looking like very minute. So the minute particulars are another important condition. Hahnemann clearly stated that one in 95 aphorism, accessory circumstance, accessory symptoms. These accessory symptoms are so part and parcel of the patient. Patient never thought it is a symptom. But when you are not focusing on that one, it's a very difficulty to understanding the symptom nature and its importance in the selection of a remedy. So it is another important point. So most of the timing it happening in the mental journals and physical journals. So most of the timings while recording the physical journals, how is your appetite? Appetite is increased or decreased, thirst is increased or decreased. We are recording like that. But you have to interrogate the nature. How much quantity of food has left. Most of the patients, they said, I have great thirsty. I have great thirsty. Most of the time, we are also recorded in great thirsty, but we are not interrogate, we are not examine how many glasses of water we have to take, what kind of water we have to take like that. So Hahnemann clearly in the Metra Medica also we have to study it. So thirsty, thirstlessness, absence of thirst. Thirstlessness, and absence of thirst. These are all three words are there very similar. Without there is intensity differ. So without understanding properly while taking the case, you are not. So even another important point I have to give. So Apis mellifica, gelsemium, pulse, there are great thirstless remedies. But they are also very good remedy for thirst also in certain circumstances during fever. So like that, there is a contradictory symptoms are there. Sometimes you have to use those contradictory symptoms for selection of a remedy. So it gives more similar or similum to the case. This is another important finding. So here, that's why to understanding the accessory circumstances also most important one. Most important one. We are not concentrated. So that's why Hahnemann clearly stated that one in which circumstance patient is coming, what is his circumstances, family environment, all things. So we are not having time to interrogate all these things. When you have interrogate like that only, you are getting the characteristic features. These are all. And another important one is, so homeopathy is a very good therapy for chronic diseases. Most of the case-taking guidelines also given for chronic diseases only, not for the acute. Why? Because the chronic diseases have significant. There is no easily getting the characteristic symptoms, all other things. Why? Because there is a paucity of the symptoms. The chronic disease definition itself, most of the timings, according to allopathic concept, the acute disease become a chronic disease. As per Hahnemannian classification, acute diseases never become a chronic disease. Acute disease is sudden onset, rapid progress, and final declining or recovery of the patient with or without remedy. Either chronic diseases or imperceptible beginning, even patient unable to recognize when it was started. So continuous progression is there. And finally, so it is added with the dynamic infection that is called a miasm. So it is the difference between pseudochronic disease and chronic disease. So you have to discriminate which one is a pseudochronic, which one is a chronic disease one. So why? Because what is the need to know a disease classification? So how we know the disease classification? After completion of your case-taking guidelines, means processing, examination of the patient and recording of all the details, there is another step done by the homeopathic man that is called case processing. So case processing means the case analysis and case evaluation, through which only we are analyze, we are evaluate what type of case it is called. Either it may be acute case, either it may be a chronic disease, or in the chronic disease also, it may be a one-sided disease or fully developed disease. So what is the need to know a disease classification? So my simple point is Hahnemann clearly explained the plan of treatment in acute and chronic disease. So the plan of treatment is quite different compared with acute disease and chronic disease. So you are more in acute diseases. What everyone thought the acute diseases are very, very easy to treat and very striking characteristic features are there. It is very easy to that one. But most of the timing, we are afraid to take acute diseases. Why? Because even the striking character, we are unable to discriminate. For example, pain is there, severe pain is there. So either it may be belladonna pain or bryonia pain or Rastax pain. In the Rastax and bryonia, both are stitching in nature. But how we can differentiate? When you have thorough with Metramedica, when you have thorough with the clinical condition, then only we are able to discriminate. You are able to select a right remedy to the patient. So that's why it is very, very important point. So, and another, while patient is anxious stage, panic stage during explaining the acute case, when you are also panic or anxiety to take the details, so you are unable to get the proper characteristic or PQRS symptoms, you are unable, through which you fails to select a simillimum. When you are unable to select a simillimum, there was no cures. There was no cures, So that's why most of the people nowadays, what we have stated that one, in acute case, I used homeopathy, but I failed to get a proper result. Even homeopathic, whoever practicing homeopathy, I'm not taking acute cases. Why? Because it's a very dangerous one when you are neglect. So maybe why? Because the progression of pathology is more rapid in acute disease. When you are not stopping the pathology, so it may landed as some other fatal complications. Even there is a chance to patient to die. So even allopathic people are seeing the patient death process in their hands. Is it possible? Anyone is there, homeopathic aspect, so patient while dying the death process, we are able to treat the patient or not. Yes. When you have to give a confidence to the patient, the patient is leave their lives or their vital force in your hands. That much confidence you have to give. Or many patients are waiting for us in the last stage. There was no scope by other medical professions. It is the only choice of medicine to treat or to provide a peaceful death. I already in last class I decided euthanasia death or some other things also there. So I have practically seen 2 or 3 cases. So they are stick on to the homeopathy even last stage of medicine. Hahnemann clearly stated that one certain life-saving remedies, arsenic album, lacases, and carboways, like that certain remedies are there. What is meant by life-saving remedy? When we have to use them. So when you have thorough knowledge in the case-taking guidelines, especially in acute cases, even in comatose, some comatose phase, we have mentioned opium comatose stage. In comatose stage or in children's, how we can take? Most of the timings will depends on objective symptoms. When you get objective symptom, in the process of getting objective symptom, we have thorough knowledge. Which one is characteristic, which one is not a characteristic. You are able to identify and discriminate, and there was no time to prescribe. Very short time is there in acute case. When you have thoroughly examined the case and thoroughly getting the characteristic and prescribe the remedy within. Here is also one more point. Every patient asked, as our homeopathic, as a physician, we have to question ourselves how much time taken to relieve the symptoms in acute case. Patient asking how much time taken to relieve. Patient get the relief, yes, very nice. He is not at all questioning. When patient not getting the result, he started to question, doctor, how much time taken to relieve the patient ourselves. So clearly, any homeopathic physician can assure. So how much time has taken to relieve an acute manifestation? Most of the time, patients are having confidence and physicians also having confidence. It takes a time. Hahnemann clearly stated that one within 3 homeopathic drug action started immediately after keeping on the tongue, even a smell, inhalation method or other things. Within 3 hours time, definitely you are getting positive result or within fraction of seconds. So there is no time taking within fraction of seconds. So homeopathic remedy gives positive result. When you are not getting a positive result within 3 hours, you can change the remedy. This is the statement given by our master Hahnemann. So that's why don't fear, don't panic to take the acute cases, even heart failure cases or severe migraine cases or some other cases. So when you have thorough knowledge with Metromedica and case-taking guidelines, especially clinical knowledge, you are able to prescribe a remedy to that one. We are provided, even as stated, my experience, homeopathic remedy gives more result, more quick or positive result compared with injections. So generally in allopathic mode of treatment, injections are used to get a quick relief. Our homeopathic remedy gives a more quicker result, quick relief compared with injections. When it is a similimum, when it is a similar. So this is a very difficult talks in case taking. When you are getting the characteristic symptom, very easy to select. In the acute cases also, to more focus on cause and effect relationship is more important. Patient clearly stated that after eating ice cream only my symptoms are started, but without confirming. So one remedy is for one cause, very easy to prescribe a remedy, but one cause, so many more remedies are there. How we can differentiate? If this is all processing in your mind only. It is the burden of homeopathic physician, not the patient, all other things. So that's why homeopathic mind is, so homeopathic physician is, so 9 tailors makes one shot. One homeopathic physician is equal to 9 specialist physicians. This was stated by our stalwarts. Keep in mind. So the process we have done very quickly and very speedily. In our mind only, you have to select a similima to provide a good cure or relief to the patient. This is another important one. So that's why in acute cases, so you find out the cause and prescribe a causative prescription. It is a very important. So one cause or more number of causes are there. Which remedy you have to prescribe? Causative prescription or cause and effective acute prescription, you have to practice it. It is more important one. And another important point, in a case of chronic diseases, so what are the difficulties? Patient is unable to recognize their past, when it was started, when there, because of paucity of the symptoms. Middle of that, they are exciting and come. Most of the timing they are saying they are explaining common symptoms only. So even they said a few number of patients, they are stated that I have headache in my left side, they have to show in right side. So that was the confusion is there in the patient, you have to bring into clarity in the picture, tracing in the picture. So because in chronic cases, because of paucity of the symptoms, because of complexity of that one, so imperceptible beginning and miasm. So these are all three complicated factors are combinedly acting, so making as a complexity. If you are not carefully examine that chronic cases, you are unable to get the characteristic features. So here the minute details are more important. If you are interrogate the patient, how you are passing stool, my bowels are regular. Well, what is the nature of stool? My stool is soft or hard or like that. But he is unable to explain. Middle of that, I passed stools when only standing position low are different position, different postures they are explained without their conscious. So you have to catch hold that position, postures, attitudes are more important in a case of chronic diseases. So when you have thorough or keen observation towards the patient or attention towards the patient, then only you are getting the characteristic feature. This is another important point. So otherwise, we are unable to get the PQRS in a case of chronic. And also sometimes there is acute reports are coming or appear acute and chronic disease. How we can treat without understanding the acute and chronic differentiation, very difficult to treat. To consider the acute totality for acute remedy and consider the chronic totality for chronic remedy. So when we want to change the remedy, when we want to prescribe acute remedy or chronic remedy, here is one more confusing point to our homeopathic people is, so chronic remedy act like an acute one, acute remedy act like a chronic. So aconite, most of the people are thought aconite is the acute remedy, but it is a very good remedy for chronic diseases. So Lycopodium lacusis, they are thought it is only for remedy for chronic disease. They are also very good remedy for acute, either maybe a sulfur or Lycopodium. So our remedies are double-edged. So what is the difficulty here? You want to know when how we have to use an acute remedy, how we can use it as a chronic remedy. Either Lycopodium is an acute remedy or a chronic remedy. You are the only person, it is your burden, your process to know when you have to use that weapon. That is the most important one. So the weapons are ready-made weapons are there in your mind, but you want to know, you have to practice when you have to use the right weapon in right situation, you are getting the cure. This is another important point. And also, so certain reactions, outcome reactions are coming in the middle of that after prescribing the remedy also in a case of chronic. So either it may be a natural disease symptoms, either it may be drug symptoms or some other symptom, you are able to analyze that one. So these are all another important point you have to that one. So these are all different difficulties what we have observed in day-to-day practice. So main difficulties are to recording of the symptoms in characteristic symptoms. And one more important point mentioned in the 98, 99 aphorism Hahnemann. So don't believe even after completion of the case taking or recording of process of the thing, you have to confirm each and every particular symptom you are getting from that one. Most of the time we are not done. Whatever the details we are getting from the patient, we are based on that only we have to prescribe that one. So these are all the different things. So we have to discuss more lengthy topic in that one. So what are the solutions? So I have to conclude this one within 5 minutes. So later on we started questioning that one. So many difficulties, many problems I have to bring into our notice. So what is the solution for that all things? What I have observed, my suggestive solutions for all these things is especially in the case, a well taken case is the half of the cure. Yes. What are the parameters to decide it is and its impact on curative process? I have to discuss on curative. What is mean by cure? So in the present scenario, we are unable to show the curative process what Hahnemann defined. Why? Because there is no possibility most of the disease. Why? Because all are mixed. There is no chance. So the drug resistance was developed or so many things. But most of the time, patient is also not stick onto that one. What is mean by cure? What are the parameters for curative process? As you are question ourselves, it's a very difficult task. Is it how we can decide this case was cured? So that's why Hahnemann stated what I have observed in homeopathy, case beginning was very easy, case ending was very difficult, especially in chronic disease. Without prescribing a miasmatic remedy, without removing the miasm from the body, there is no possibility of cure. How we can remove? Sometimes one remedy is essential. So Hahnemann clearly stated that a series of miasmatic remedies are essential to remove the miasmatic. So what is the plan of treatment in that one? So if you are thoroughly taking the case, you want to know the plan of treatment. For every case, your own plan, not your own plan. As per guidelines, you have to make it as a plan. When you are treated according to the plan, that is. So that's why the miasmatic prescription or acute prescription and chronic prescription are different kinds of prescription, either causative, based on common symptoms, based on mental symptoms, or characteristic, pathological, or keynote prescription. Different types of prescriptions are there. So different stalwarts, their approaches there differ towards one particular prescription. So without understanding properly, when you are not taking thoroughly the case taking, we are unable to make it. We are not unlike. Here, one more key point plays an important role: interpretation of the data. Whatever the data you have to collect it from, you have to, by using your artistic technique and scientific knowledge in your brain, interpret it and logically correlate, then you are a good prescriber. So a true physician. So what are my suggestive solutions for that one? So whenever taking the case, as much as possible, so you are maintain unprejudiced. Unprejudiced means, in my point of view, don't keep in your mind whatever the patient brought. So after completion of the data, you have to interpret, and what are the remedies come in your mind, you have to prescribe. Don't keep in your mind some remedies and you have should not questioning along with your remedy point or other things. So after completion of, so as much as possible, maintenance of neutral state in the mind. That is first one. Another, my suggestive solution is keen observation. So you must pay attention towards the patient, or either anxiety or irritable, whatever thing. The affected part may be a red, the affected part may be cold in nature. So when you are paying keen observation, then only you get the characteristic picture. For every observation, for every objective symptom, every observation, there was a remedy in our Medica. When you have thorough knowledge, very easy to matching. So homeopathy is a straight line in between the two. Homeopathic cures are a straight line in between 2 points. One is disease, another one is remedy. When you have correlate, so how much similar is there, you have to that. So the cure mainly depends upon how much similarity or homeopathicity towards that one. So you act for maintenance of that, you must act like a architecture. How closely you are drawing the picture, so very easy to impress. Impress means you get the curative process. Another one is interpretation of the data. So don't believe, interpret the each and everything. So which technique is used for here, either Kenti technique or boning acid technique. You have to learn all the techniques. You have thorough with all the techniques. You have to use it. As per my knowledge, you are not traveling by a bicycle on a tar road, or you want to go to America. You want to go to America, you can go only flight only. So like that, different approaches. Their aim is only cure of the disease. So you have to learn all the techniques, either mental general. Some people are there, they are only concentrate on mental generals. They concentrate physical generals are like that. It may not be a good one. You have to learn all the techniques. You have to use. Mental generals are there, you have to use. Physical generals are there, you have to use. Particulars are there, you have. In one-sided disease, you are not getting fully picture. So what is the process explained by Hahnemann? You have to implement. Whatever the available characteristic, you have to prescribe again. So what happening? You are not getting all these things. Your remedy may not be similar to the case. When remedies may not be similar to the case, it may be dissimilar. What happened to dissimilar disease meet in the body? We have to study. When dissimilarity is there was no chance of curing the disease. This is another important. So that is why interpretation of the data. So, and you have different approaches are there. You have to use your artistic creative technique or brain. So which one is good for the patient? Which one is good for the patient? And thoroughly examine the patient to bring the certain characteristic through your examination, and it is used as a constituting the totality. It is used for constituting the totality. So definitely, it fulfill the simillimum. It is a complete totality. So when you are adding examination finding to the totality, it may be a complete totality. And another thing is understanding the circumstances. Sometimes the standard circumstances are gives a clue for to select a remedy, because suppressed emotions are there. How we can? So most of the time we have what happening? You are not able to prescribing a similar remedy. It is another important. So homeopathic suppression. So on the earth, homeopathic suppressions are more dangerous than any other medical suppression. Keep in your mind. It is very, very important. Even patient may die. Sometimes most of the people they are buying homeopathic medicines in the shop or other thing, mother tinctures. Liters ourselves we are drunk itself are consuming that one. It can produce drug diseases. Drug disease also not only resulting because of other things. So by using, whenever you are not using the homeopathic remedies, so according to the similar principle, that's why one quotation is there. All homeopathic remedies are prescribed by the homeopathic physician. Homeopathic prescribed remedies are not homeopathic remedies. Keep in our mind. Why? Because there must be a process similarity relationship according to the minute dose, all other things. These are the most important. And another thing is, so understanding
excuse me.
Yeah.
I'm just interfering because the time is limited.
I think, sir, 2 minutes, 1 minute, sir. And also different approaches, different types of prescriptions you have to use and allow and be confident while taking the case. You can assure to the patient and also explaining the homeopathic curative process to the patient. What are the symptoms you are getting relieved fast after taking this remedy? What are the things essential for us to prescribe a remedy? When you have trained your patient, next visit, patient himself gives a good characteristic features to you. It is a very, very important to us to select a similar remedy. So this is the my suggestive solutions for a well taken, a thorough taken. What are the parameters? Last statement. The parameter is your artistic analysis or interpretation of the homeopathic case taking guidelines according to the science, and how much restoration of the patient's health and healthy, how much bring back to the normal. The curative process, that means bring back to the pathology, bring back to the normalcy is the evidence for our cure. Cure means there was no recurrence of or again repeating the same set of symptoms in the patient. Okay, sir. Completed, sir. Please start your. Any question is there? Please ask.
Thank you, doctor. We are going to have another session with you, and the questions will be asked on that session itself. And we go to know and we go to understand everything. You made us, guided us, warned us, and motivated us with this speech. And on behalf of IFPH, I thank you for this session. And please come again with more topics. And our forum will be always welcoming you. Today we are having limited time. We need to start another session in Malayalam. So I thank you and I thank all who presented here, participated here in this session. And over to Malayalam, Dr. Manoj, please.
എല്ലാവർക്കും നമസ്കാരം. IFPH 1767